Hi, I'm Dr. Murray, chiropractic physician and naturopathic physician from Murray Natural Health and Chiropractic here in Hastings, talking to you today about Breast Cancer Awareness Month, this month right now, and to bring this message to you that let's beat breast cancer. There's a really neat initiatives out there now that are right out in traditional mainstream media promoting true aggressive prevention. And that's what we should be promoting in our offices daily. Because I'm really tired. I know that many of you have voiced concerns and frustrations in my office as well. You go to these different breast cancer awareness booths and they're handing out soda pop and candy and those things. And we know that those things do have an effect on cancer rates. It's not that sugar causes cancer, but we know there's an association between highly refined sugars and cancer. And then I'm also tired of hearing that mammograms are the only way, the only method or mode to help in the fight against breast cancer. Is like that's the end-all be-all of prevention strategies. When in reality, if you look at the 2017 as well as 2012 studies from the New England Journal of Medicine, they certainly come out and they say conclusively that mammograms are not all they've been talked up to be, and that actually the number of decrease in deaths associated with breast cancer have not come because of screenings. They've not come because of screenings. Screenings with the false positives, negatives with mammograms, they have not lived up to the expectations. So there has to be more, and that's what most of the research is now coming out, like I said, over the last about 10 years, coming out and saying that we need to do more than looking at just mammograms. Mammograms aren't really prevention anyways. They're early detection. And that's not necessarily a bad idea. I mean, early detection isn't necessarily a bad idea either, but we need to be focusing on other preventative strategies, aggressive prevention strategies first. Breast cancer, it's the most common cause of cancer-related death in women. In 2019, estimated 268,000 new cases of invasive breast cancer are expected to be diagnosed in women in the U.S., along with 62,000 cases of non-invasive breast cancer. Around 47,000 women die each year from breast cancer, and around 1% of breast cancer victims are actually men. So it's not just women. There's around in excess of 350 guys die from breast cancer each year as well. So it's a serious issue. Well, some of the new initiatives that are coming out here, such as from the nonprofit Physician Committee for Responsible Medicine, it's a nonprofit organization, and they focus on 4 simple science-based strategies for reducing breast cancer. 1, eating plant-based foods. Okay, that's an important thing. We know that you are what you eat. If you're not eating plants, you're probably going to have some problems because all the nutrient value that's contained within plants. Eating more plant-based foods. Secondly, regular exercise. Many studies have shown that actually including exercise in your routine, yes, it helps with cardiovascular disease, as well as diabetic conditions and metabolism and any of those, but also with cancer and breast cancer in particular. Third, limiting alcohol consumption. Alcohol is a carcinogen. It's a toxic substance. And limiting alcohol consumption at the very least is a good thing. Too much certainly isn't good for you. As well as maintaining a healthy weight. That's been shown to have a huge impact on breast cancer rates for sure. So we need to be focusing on aggressive prevention. So check out some of their material, the Physicians Committee for Responsible Medicine. Let's Beat Breast Cancer, their initiative. Super cool. They're focusing on aggressive prevention there. But other things that also affect cancer rates. Vitamin D, there's all kinds of studies. On our Facebook page, we have a recent article talking about vitamin D deficiency because it affects the immune system. And so you're more likely to have breast cancer and cancers in general and lots of other conditions if your body does not have what it needs, and vitamin D is just one of those things. Hormones, if you have excess amounts of estrogens or not enough progesterone, then that can certainly increase your risk of breast cancer and other proliferative disorders in the body. And that's why testing hormones, something we do on a regular basis in our office here, is a good thing to do. When we do thermography in our office, we do breast thermography. And there's an image image of that up on my screen back here. So breast thermography, and you can use thermography or thermographic images. You can do that in other places of the body as well. But when you're doing breast thermography, sometimes you can actually see different heat signature patterns and vascular patterns that give us an indication that there's excess amounts of estrogens that are present. And with that, then you need to start asking the questions. Well, what hormones perhaps are you high end or low end you need to deal with? Well, you can actually test for those things. Of course, there's other genetic factors. You can do testing for that as well. Some people may have an MTHFR genetic mutation. You can't change your genes, but you can change the environment in which your genes manifest. You can change the environment in which your genes actually work inside your body. And by dealing with some of those genetic factors, some people may have methylation problems, etc., antioxidant problems, and they can have specific testing that we do in our office can get to the root cause of those things as well. When we have abnormal readings on our thermograms, and we do these monthly in our office, so make sure you give our office a call and schedule time to do that thermography screening. But when we have abnormal readings there, sometimes it will refer out for additional imaging. It's important. We don't want to put our heads in the sand. There are other testing that can be done as well, such as we do breast tumor markers in our office here. We also test for the AMAS test, which is the anti-malignant antibody in serum test. So there's lots of other tests that can give us an indication whether there's a problem going on. But one of the best early breast proliferative tests you can do, or showing you that there's a problem in the breast tissue, is of course a thermogram. And you can check out our website looking for more information on that particular service that we provide. But that, before you have diabetes, there's pre-diabetes. Well, before you have cancer, there's often kind of a pre-cancer. There's an abnormal tissue, abnormal physiology that's occurring there. And you can test that. You can see that on thermal imaging. And so this is my message is that we should be always focusing on preventative issues first. And we have to do more for our ladies out there. And for the men, but for our ladies out there, we have to be doing more than doing the standard of what's being done, because it is failing. All the studies are showing it's failing, and it's what's been done, but we need to aggressively prevent conditions. And part of aggressive prevention is doing exactly what the Let's Beat Breast Cancer Initiative is talking about, which is talking about changing your diet and exercising and maintaining a healthy weight and all those things, but other more precise and other ways of looking at these cancer conditions and looking at the hormones themselves through, like I said, through the thermographic imaging. All those are important to do. So if you're interested in the thermography in our office, please don't hesitate to give us a call, and I'll be happy to help you out with that. And let's beat breast cancer. Make sure you check out that information on our website as well. We have a link on there too. Thanks so much, and have a blessed rest of your day.